not have any room for adults.
Good morning, Mr. Smith.
Come in.
Good morning.
Good morning.
Welcome to the unit. My name is Lisa. I'll be your nurse today.
Nice to meet you.
May I start by asking your name and date of birth, please?
John Smith, 1/1/1980.
Great. Can I take a look at your wristband? All right. Everything matches up. Perfect. Thank you. Would you mind if we do a brief physical assessment on you today? This shouldn't take long. It'll give us information about your health and how we can take better care of you.
No, please go ahead.
Great. Thank you. We'll start by providing some privacy for you by drawing the curtain. Excuse me one moment while I sanitize my hands. Great. So first I'll start by asking you some questions. You already gave me your name and date of birth. Could you tell me where you are right now and today's date?
Today's date is September 10th, 2021, and I am in the hospital.
Okay, great. Thank you. So first we're going to start by examining your head and neck. We'll move on to this assessment. I'm going to look for any abnormalities. Does anything hurt you?
No.
Okay. I don't see any physical abnormalities or anything to be concerned about. Okay, so may I ask, do you wear contact lenses or glasses to correct your vision?
No.
Okay, perfect. So next I'm going to examine your pupils and I'm going to use my pen light. Is that okay if I dim the lights?
Yes.
Okay. So I'm just going to come in from the side on each side of your eye and just check a few things with my pen light here. Okay, perfect. So your pupils are round and reactive to light and they dilate and contract appropriately, which is great. Next, we'll move on to your mouth. Do you wear dentures or have any loose teeth?
No.
Okay. Can you open your mouth and stick out your tongue for me so I can look inside your mouth for any abnormalities? Okay. Can you say ah, please?
Ah.
Okay, you can close your mouth. You appear to have good oral hygiene. I don't see any abnormalities or sores or anything like that. And your mucous membranes are pink and healthy looking. So next I'm going to examine your upper extremities. Do you mind sticking out your arms, please? Okay. Your skin looks clear. It's not blotchy. No cuts or abrasions. Perfect. Do you mind if I check your pulses?
No.
Okay. So I'm going to check your radial pulses. Okay. Great, you have a strong pulse on each arm. Do you mind if I just ask you to hold your arms out, please? Okay, can you bend them at the elbows? And can you put them out to the sides? And back again, and up and down? Do you have any pain with that?
No.
Okay, looks good. So next, I'd like for you to stick out your hands again, please. I'm just gonna check something called capillary refill. And this lets us know about the oxygen flowing to your extremities. Looks good. I'll check this one too. So it's about 2 seconds, which is normal. Perfect. All right, and then I'm just gonna ask you to hold out one of your arms, please. And close your eyes. Can you tell me where the pen is touching you?
On my forearm.
Okay, perfect. Let's move on. Next, I'm going to listen to your heart at your apical pulse, which is basically your heart's main pulse point to check for the most accurate pulse. And I'm going to use my watch and count for 1 full minute. Okay, great. So it looks like your heartbeat is 72 beats per minute, which is normal. Next, I'll move on to the lungs. I'm going to need to listen to your lungs in the front of your chest and in the back. And we're going to listen to it in 8 different spaces on each side, okay? Are you comfortable?
Yes.
Okay. So just take a deep breath in and out with each movement of the stethoscope, please. Okay, let me do the back now. Okay. All right, your lungs sound okay, a little wheezing in some areas, and I noticed you were coughing when you took a deep breath. Can I ask, are you a smoker or have you smoked in the past?
Yes.
Okay. Well, when we are finished with this assessment, do you mind if we talk about your smoking?
No.
Okay, great, thank you. So next we'll examine your abdomen. Would you mind please laying back? Okay. So visually your abdomen doesn't appear to look abnormal. I'm just going to feel around for a little bit and just see if you have any painful areas or lumps, okay? Does anything bother you?
No.
Okay. So I'm going to listen to your abdomen. I'm going to listen to your bowel sounds in 4 different spaces just to make sure that everything sounds good. Okay, perfect. So everything sounds good. You have positive bowel sounds in all 4 areas, which lets us know that waste is properly being moved through your intestines and there's no blockages or anything like that. So that's great. So next we're going to move on to the lower extremities. So I'm going to examine your legs if that's okay with you, okay?
Yes.
All right. So your skin looks good. There's no cuts or any blotchiness or anything like that. It feels good. It's not too warm, and you don't appear to have any swelling at all in your lower legs, which is good. Okay, and I'm just going to feel for the pedal pulses. Okay. All right, good. So you have very strong pulses in that area in your feet. So the next thing I'm going to ask you to do is if you can try to raise up your leg while I'm pushing down. Okay, and can you do this one? Raise up your leg, please. Thank you. Okay, can you put your leg up and down? Okay, and the other one? Okay, and can you bend them at the knees? Okay, great. Do you have any pain with that?
No.
Okay, perfect. So I'm going to ask you to close your eyes and let me know where you feel the pin touching you, okay?
My right leg.
Okay, perfect. And one more time.
My left foot.
Okay, great. Everything looks really good. So you can sit up now. We're done with the physical assessment part. So I'm just going to ask you a few more questions if you don't mind. So is it okay now if we talk about your smoking?
Yes.
Okay. So how long have you been smoking for?
28 years.
Okay. And how many cigarettes a day do you have?
10 to 12.
Okay. Have you ever tried to quit in the past?
No.
And are you considering quitting now?
Quitting's for losers, Doc.
Well, that was a very funny joke. But in all seriousness, do you think you'd be interested in quitting?
Yeah, I'm gonna quit now. Right.
What do you think has been holding you back from quitting in the past?
My wife.
Well, I'm sure you have been told before by your doctor that smoking is very harmful to your health and can pose some serious long-term illness risks like cancer and lung disease and heart disease. And when we listened to your lungs, I did hear some coughing when you were taking a deep breath in and out, which shows that your lungs already have some damage and have undergone some potential injury. And I know it can be difficult to quit smoking cold turkey. And may I ask, have you tried anything in the past, like medications or patches, or even heard about anything like that before?
No.
Okay. Well, these can be very helpful in cutting down and quitting smoking, which can give you an edge to succeed. Would it be okay if I gave you some resources and tips to successful smoking cessation?
No, thank you.
Well, I'm going to leave you this brochure on the table here, and I'll just be back in one moment. And if you change your mind, let me know. I'm just going to grab something and be right back. Wow. Okay. I'm back, Mr. Smith. Okay. So, have you had a chance to look over the information?
Yes.
Okay, great. So would you be interested in talking to the doctor now about your desire to quit smoking?
I'm not concerned. My wife's going to kill me way before the cigarettes do.
Okay. Well, I'm going to mention it to him if you don't mind. He may have some additional insight as to whether maybe prescriptions and medications may be helpful for you. Or maybe talk about what's maybe holding you back, because you do know it impacts your health. And we just want to see you healthy.
Okay.
So do you have any questions right now for me?
You validate parking?
Can you tell me what are some of the things that you took away from our conversation on smoking cessation today? Did you learn anything?
Yes. I learned that I should quit
Why do you think that you should quit?
because I'm wheezing and coughing.
Okay. And do you think it's just about the wheezing and coughing right now, or is there another reason why you think you should quit? Perhaps some long-term effects?
Yes. I think I could use more oxygen.
Okay. Okay, Mr. Smith. Well, thank you for your time. I'm going to document all of this information and pass it on to the doctor. And we'll be back a little bit later to go over your treatment plan and anything else that we need to talk to you about in the hospital. Do you need anything before I leave?
No, thanks. I'm good.
Okay. Well, here is your call button. If you need anything, please don't hesitate to call.
That's where the morphine comes.
Thank you.